much, and thank you for having me in the first place. I think it's a true pleasure to be able to speak to so many colleagues across the world, and especially about a topic that I'm very passionate about. Just over a year ago, we started the Feline Diabetes Remission Clinic, just because we are so interested in this disease that is increasing in prevalence, and that we as practitioners are therefore fighting with on usually a monthly basis if you are in a busy practicing loads of cats. So as said, the first seminar or webinar will be about why this disease occurs, and sometimes clinicians shy a little bit away from the whys behind the disease, but I would really encourage people to pay attention here, because if we want to uncover that recipe for remission or treating feline diabetes mellitus really well, then we will be better off knowing how the disease works in the first place, and we will be able to make practical decisions in the management of these cases because we understand the disease. So hence the start off with why does it occur in the first place. Now hopefully technology will be with me here, and we're going to go through the slides. Just now it usually takes a little while for the PowerPoint to get to grips with me pressing the buttons. So let's have a little look here. There we go. Very good. So we're talking about cats, and cats that get diabetes at increasing prevalence. Latest numbers talk about 1 in 200 of every single cat will suffer from this disease. And a lot of developments have taken place in the management of diabetes in cats. Just showing you some pictures that illustrate some of these developments. So if we go from the top left, where we can see that Lantus insulin, a new kind of insulin, is being increasingly used. Then we see clockwise a picture that illustrates the economic crisis that is affecting various parts of the world, so which illustrates that we need to be smart in managing this chronic disease that in fact costs a lot of money, and therefore we also need to make sure in our management that we don't spend too much money too early or too much money over the long run, because that will result in decreasing numbers of owners being able to pursue treatment in the long run. We also are figuring out more and more that there is a genetic basis to diabetes, and it gives us hints as well towards what ideal treatment strategies are. Then we've discovered that in a proportion of cases, and the second webinar will talk about that more, we actually can beat the disease and we can get rid of the diabetes, which is great. There's quite a bit of controversy about food. We also have discovered that sometimes we're dealing with a different type of diabetes, and on top of that, a lot of owners are diabetic now as well, and they will confront us in our consult rooms about the differences between the approach that we are suggesting with their cat and the approach that they are being told is the right approach by their GP and their medical doctor about how to treat their human diabetes. So we need to be prepared to answer questions from increasingly critical, increasingly knowledgeable owners as well. And then we've seen more and more owners being able to do home blood glucose monitoring. Now, all those new factors, all those new developments, if we throw in the mix something powerful as Google, then we can get quite critical questions from our owners on the basis of some facts and certainly some things that are definitely not true. Hence, we as clinicians need to be up to date, up to scratch with our knowledge about this increasingly prevalent disease. Hopefully this webinar will give you the ammunition to answer those critical questions, because we will. Yes?
Could we just try, you're crackling quite a lot, so I don't know, okay. Is the microphone by your headset? Otherwise we may just need to try the telephone to see if we can get slightly better sound, because it's a fairly consistent crackle. It's not, we can hear you and everything, but just over 2 hours I want to try and get the sound as good as possible.
Absolutely. Can I move the microphone a bit away or towards my face? That is possible. I don't know if that's something that will help.
Yeah. Have you got it? You've got a headset, so is it
I've got a headset.
quite close to your mouth at the moment?
It was a bit. So if I do this, is this going better now?
Just speak for a little moment, just so
Okay.
we can hear.
I'll speak a little bit more about things. Is this better now for you and the audience?
Just if people can just make a comment if they can hear okay and they're happy with the sound, or if it is quite crackly with them, if Stain just carries on talking.
Okay.
Of course, we're having, I suppose, something of a diabetes epidemic, aren't we, both in human medicine, and I suppose it's with obesity in the small animals, also in the small animals as well, dogs and cats.
Absolutely. Yeah, absolutely. Especially in cats, though. In dogs, we're dealing mainly with a type 1 diabetes mellitus, which I'll illustrate in a slide or two. And actually, obesity does not cause diabetes in dogs, although it does complicate the subsequent management. So that's often a myth that is around there in the world, that obesity causes both canine and feline diabetes mellitus. There is certainly a strong link with feline diabetes mellitus, but not with canine. But once we are starting to treat the dogs, of whom we don't speak today in this webinar, we do want to have them get rid of any obesity, because the response to insulin will be hampered by existing obesity. Does it sound a little bit better now?
People seem to be happy with the sound, so we'll move on. If I'll try not to, but if I need to jump in again, I'll jump in.
Very good.
Thanks,
Very
Steve.
good. No worries. So we're going to talk about what's new in the pathophysiology, again, to understand this disease better, to subsequently treat it better, and what's new in the diagnosis in this first webinar. So let's focus on what's new in pathophysiology. So a question that I certainly get from quite a few owners in the consult room, and you must have the same experiences. Why did my cat get diabetes mellitus? And this particular owner on the right asked as well, does my cat have the same type of diabetes mellitus as I have? And the hint to bear in mind in there is that the picture depicts a younger female owner. So let's look at that. I mean, it's always been quite customary to say, well, if we've got a dog here on the left of my slide diagnosed with diabetes mellitus, we're happy to say, well, that's a type 1 diabetic, so immune-mediated destruction of the beta cells that results in a state where not enough insulin is being produced. If we diagnose diabetes mellitus in the cat, we quickly assume that it is a type 2 diabetes mellitus, of which the pathophysiology will explain in a little bit. And that has been the state for quite a few years now, that we automatically decide this. There are some issues there that we need to raise in this webinar, which we shall do shortly. But in principle, it's still true that most cats suffer from this type 2 diabetes mellitus. It's the most prevalent form. And why we say that is that we see a similar islet cell histology when we look at the pancreas under the microscope as we see in humans with type 2 diabetes mellitus, which is the type of diabetes mellitus that affects older people, although younger people are suffering from this form of diabetes mellitus as well, and that indeed is associated with obesity and inactivity, but there's also a genetic component to it. When we look under the microscope, we see quite a bit of amyloid deposition, and that's both seen in human type 2 diabetes mellitus and in these cats with diabetes mellitus. I mentioned the risk factors, obesity and inactivity, but also the clinical behavior is very similar to these humans with diabetes mellitus, where initially we see increased production of insulin, and we also see that remission is possible both in the cat and in the human with this type of diabetes mellitus, which is very distinctly different from type 1 diabetes mellitus, which we also see in humans, but in younger individuals and in the dog. And most recently, and this is very exciting development in research in feline diabetes mellitus, we have been able to show at the Royal Veterinary College as part of our diabetic remission clinic that the genes the abnormalities in the genes that we see in humans with this type 2 diabetes mellitus, we also can find in many of these cats with diabetes mellitus. So that is really fresh off the press